travel is being restricted across the world right now, and that is to slow the spread of COVID-19. But B&A is open for business. Blake Rosnowski has details from the Centers for Disease Control in the newsroom. Good morning.
Amy, so the CDC isn't suggesting altogether that people stop traveling, but they do have some things to think about if you are reconsidering. Some of those include looking at where you're traveling to. Is that place a destination where COVID-19 is spreading? Well, there's going to be a higher risk there for you coming into contact. Think about how it could affect you when you get home if you do come into contact with the illness. You may have to self-quarantine for up to 14 days after traveling, so that'll keep you away from work and school. The virus can be much harder on older adults or anyone with a severe chronic health condition, so if you live with them, it's something to consider. Think about who you're traveling with and if they could be going to crowded places or public events like conferences or concerts. It may make you more likely to contract the illness. It's also a good idea to reconsider travel if you yourself have a higher risk of getting really sick if you were to contract COVID-19. Right now, the CDC is recommending anyone who's older or has serious medical conditions to avoid non-essential air travel and cruises. If COVID-19 is spreading in your area, you may want to reconsider if you'll then be in close contact with anyone who is at a high risk of getting seriously sick, especially if you're exhibiting any symptoms. So it's also a good reminder that those symptoms may not be serious. You may not even show that you have a flu, but that does not mean that you are not possibly contagious. If you do travel, make sure you're washing your hands well and often and try to avoid touching your face. Live in the newsroom, Blake Rosnowski, News Channel 5.